Good afternoon. Thank you for coming to this press conference. Since the last press conference, the situation has remained stable. The week-on-week infection ratio has stayed around 1 or lower. The proportion of severe cases in the past week has also remained stable. The stabilisation phase will end on 21st November, and we will return to the transition phase. We are now in a better position to further relax the safe management measures. From 22nd November, we will allow groups of up to 5 fully vaccinated persons to dine in at F&B establishments, even if they are not from the same household. From 23rd November, this will also apply to hawker centres and coffee shops, which are able to put in place the necessary checks. Hawker centres and coffee shops which are unable to do so can continue to have groups of up to 2 fully vaccinated persons to dine in. We will also align the permissible group size for social gatherings. This will be increased from 2 persons to 5 persons. In addition, we will increase the cap on daily number of household visitors also to 5. However, we strongly encourage unvaccinated individuals to continue to stay at home as much as possible to protect yourselves. Do also take the necessary precautions when you are visiting those who are more vulnerable. For example, if you are visiting a household that has an unvaccinated person or vulnerable elderly that you are aware of, you can protect them by testing yourselves prior to the visit. As we further ease our SMMs, vaccinated-differentiated SMMs or VDS will continue to be a key measure to protect those who are unvaccinated. The People's Association and Sports SG had earlier launched pilots on activities for seniors who are fully vaccinated. Drawing on lessons from these pilots, we will resume more of such activities in a safe manner in the coming weeks. Seniors can look forward to more active aging programs by the Health Promotion Board and the National Silver Academy in time to come. More details will be released soon. From 1st December, we will also expand VDS to more settings and activities. This will include all libraries under the National Library Board and selected activities in the community clubs. As earlier announced, we will extend a concession to those who are medically ineligible for vaccination from 1st December so that they are able to access premises or participate in activities where VDS are imposed. This will include dining in and visits to hospitals and residential care homes. I would like to take this opportunity to thank everyone for your patience and your support. We are able to make these adjustments because you have helped to keep our infection under control. We are now transiting towards living with COVID-19, and I know many or some prefer to open up more quickly, but we must do so in a very careful and step-by-step manner. This means that we will ease some measures, observe, monitor, and ensure the situation continues to be under control and stabilized before easing further. This way, we hope to avoid any disruptive U-turns. This cautious step-by-step approach has allowed us to continuously allow more activities to be resumed in the community and allow the economy to also be opened up gradually. We have also established vaccinated travel lanes with several countries, and this has allowed us to strengthen our position as a hub for business and travel. But having said that, COVID-19 is an unprecedented pandemic, and the virus is still very unpredictable, and we may have to continue to tap on brakes from time to time. We will try our best to avoid that as much as possible. So let us continue to be vigilant, exercise social responsibility, and make testing a way of life to keep infections under control and protect our healthcare system and healthcare workers. By working together, we'll be able to progress in our journey towards COVID-19 resilience. Thank you very much. I will now call upon Minister Ong Ye Kung to give an update.
Thank you. You heard the changes that we are making from Min Gan, so let me try to explain the situation we are in and how we come to these set of decisions. We have come to a critical juncture in our battle against COVID-19. Be mindful that we are still going through a fairly big wave of transmission, and which started last week of August. The cases in last week of August started was 100 cases a day, and it went through 5 cycles of doubling and reached a 7-day moving average of around 3,002, and that was in end October, and it peaked then. Then after the peak, the daily cases stabilized and then started to come down, and as it come down, we will then notice the week-on-week infection ratio falling below 1, and that prompted the MTF to relax the rules quite cautiously last week to allow 5 persons from the same household to dine together. And for the past 11 days, we watched the situation very closely, and thankfully and fortunately, cases did not go up, and in fact, it was even more subdued. So as we come to the end of the stabilization period, which is this Sunday, the last day, we have to decide what's our next steps. So I will explain further the pandemic situation, while Minister Lawrence Wong will further elaborate on the measures that we are taking. I'll run through a few indicators. Number 1 is the stock of patients. As the number of infections come down, and so has the total stock of patients in our system. Most of them, great majority, are on home recovery program. It has stayed consistently above 20,000 patients at any one time throughout October, peaking at 26,386 on 29th October. So the last week of October is when we have the worst. Since then, it has been decreasing. It dipped below 20,000 on the 7th of November, and now it's just slightly over 15,000. And every day we continue to discharge about 3,000 patients. Oslo, majority from HRP. Second indicator, reproduction number of the disease, or R. This has been held at around 0.9 to 1. Yeah. And I want to mention that we held R at about 0.9 to 1 despite a very noticeable increase in footfall throughout the past few weeks, throughout the island, over the past 1-2 weeks, because more and more people are coming out, socializing, and they're out and about. And in fact, today, the footfall that we measured across popular destinations is only about 5% less than at the peak of the stabilization period, at the peak of the preparatory phase in early September. And if you remember, during the preparatory phase, we do allow 5 persons dining. And this is a good sign. It means that more human activity did not drive infections and hospitalizations up. And what it means is this, that our society is becoming more resilient to the virus. Third indicator is severe illnesses. At the peak of our current transmission wave, the average number of patients hospitalized needing oxygen supplementation or ICU care is about 420. That's a stock number at the peak. Now it is around 370. If we zoom into just ICU, we had about 140 patients during the last week of October at the peak of this transmission. This has come down to about 110 now. As of last night, it was 110. Next, incidence of severe illnesses. So, very importantly, the incidence of patients falling severely ill, needing ICU care or died, has come down. So we track that number longitudinally from August to September to October. The number has fallen from 12 per 1,000 infected individuals to 5 per 1,000, to 6 per 1,000, and then to 5 per 1,000, respectively. And it is likely that if we track beyond October to have a November number, I think very likely it will go even below 5. And this is significant, which means that every time you get 1,000 people infected, you can now count on the fact that a fewer number will fall severely ill, needing ICU care or die, compared to, say, in August or September, that the number was higher then. What has contributed to this decline is the increased uptake of boosters by vaccinated seniors. And therefore, even if they are infected with boosters, they are less likely to fall severely ill. But more importantly is that fewer unvaccinated seniors are now getting infected. Yeah. So for every 1,000 people that are infected now, you expect fewer unvaccinated seniors amongst that 1,000. And that impact is direct and significant. Because this group, unvaccinated seniors, is 1% of our total population, 6% of the population of seniors, but 2/3 of the population in ICUs. At its peak on 19 October, we had, and that was a bad day, 19 October, we had 119 unvaccinated seniors infected that day, 119. Many of them ended up in ICU or died, amongst that 119. In the last week of October, the number has eased to an average of 60 a day. In the past week, we have less than 40 a day of unvaccinated seniors being infected. Why has the number fallen? A lot of work has gone in to bring this about. Number one, the population of unvaccinated seniors continues to shrink as our vaccination teams continue to reach out to them, even in their homes. In end October, we had 65,000 unvaccinated seniors above the age of 60. As of today, we have gone below 60,000, in fact, about just slightly over 59,000. So 5,000 more became fully vaccinated in the matter of 2 weeks, and many lives were saved as a result, I think. Second, number two, due to our vaccination differentiation safe management measures, or VDS. Because of VDS, unvaccinated seniors are restricted in their access to crowded places, especially in places where people tend to pull down their masks and talk, such as dining in hawker centers and coffee shops. And so they are now much less likely to be exposed to the virus. And in order to resume their activities, many of them chose to walk into our vaccination centers and get themselves vaccinated, which is a very good thing. So in summary, we are in a better position compared to end October, the peak of the transmission wave. But it is early days, no? And we are far from out of the woods. We still have a couple of thousands of infections a day, and people continue to be admitted to ICU, and every day we do see people dying. And we know all this continue to worry many Singaporeans. So our bicycle has slowed down its descent to a controllable pace, but it is still some distance away from safety. And if we look down the slope on our bicycle, it's a steep slope down still. But we know we have a few brakes at our disposal and can work effectively in the coming weeks and months. One is our booster program, which is gathering pace. We have administered over 1.2 million doses, covering 21% of our population. At some point, we will need everyone who has 2 doses of vaccine to get a third one. And indeed, with the Delta variant now, there is an emerging view amongst the clinical and scientific communities that globally, that this is really a 3-dose vaccine, just like hepatitis B. And that view is emerging. We have thus far administered booster after at least a 5-month interval for seniors, and then 6 months for those aged 30 to 59. Our expert committee have further studied the latest international data and have now recommended that we can standardize at 5 months for all age groups. So we will begin this new arrangement from 29th of November. So with this change, from now to end December, we hope to administer about 1.5 million boosters in addition, raising our coverage from 21% of our population to about 50%. And this means by year end, half of our population will be freshly boosted with high levels of antibodies. In addition, many more individuals will recover safely from COVID-19 infections and add to our societal resilience. For the few remaining unvaccinated, not too late to come forward and get yourself vaccinated. We also now have a strong VDS system already in place to protect the vulnerable, and we are further rolling it out to hawker centers and then coffee shops. This makes a world of difference. As I mentioned earlier, it makes sure that for every 1,000 infections, fewer and fewer unvaccinated seniors are amongst them. So it makes a world of difference, and we need to implement it well, and we need to seek the understanding of everyone that we need to do this. There is one more additional consideration, which is timing. We are now in end November. Once we cross to December, there's a certain mood, and then we are moving closer towards year-end festivities, and there will be pent-up demand to want to go out. So as far as possible, we don't want to do an opening move that is significant in the month of December, because we risk, once opening, so social activities will spike up very high, and it will drive it can drive and spark off a new wave. So if we can open up earlier to allow society, families, friends to gradually ease into a festive mood. So we therefore have before us a valuable window of opportunity for us to open up further. It will likely lead to more social interactions, which will increase the circulation of the virus. It may also result in more cases daily and even more hospitalization. However, the impact of this on healthcare system, healthcare outcomes will be counteracted by the three things I just mentioned. Boosters, that is gathering pace, safe recovery from COVID-19, and then VDS. And if we miss this window and delay opening until next year, protection from boosters against infection and symptomatic disease may weaken by then, and the case numbers and public health outcome will likely be worse than if we open up now. And that's why we come to the decision today that we will make a move to open up from two packs per group to 5 packs per group. Minister Lawrence Wong will now explain the steps that we are taking. Thank you. I'm sorry, DMS Kenneth Mark will now explain the healthcare situation further.
Thank you very much, Minister. I'll focus on the general COVID-19 situation based on the data we've had as of yesterday, the 19th of November, and the situation in our healthcare facilities, and expand on some of the details that Minister Ong has shared. The majority of those infected with COVID-19 remained either asymptomatic or mildly symptomatic, and this represents about 98.7% of the total numbers infected with COVID-19. About 87% of these cases are recovering within our home recovery program or at the community isolation facilities because they are unable to safely isolate at home. Not all who have mild infections are recovering at home, and this is because they may have high-risk features which require closer monitoring to detect early any clinical deterioration so that they can receive timely care for their illness. They are part of the 4% of cases being cared for in our community treatment facilities, as well as forming a small proportion of the 7% of cases that are presently admitted in our hospitals. Vulnerable people accounted for 4.8% of our total community cases over the past 4 weeks. And as Minister Ong has shared, this is down from the 7.2% of cases that we saw 4 weeks earlier. The share of cases in the older population has generally trended downwards. This trend is observed mainly in the 50 to 69-year age group. Our proportion of seniors above that age, in other words, 70 years and above, who have got infected has remained relatively stable, but the proportion of younger people being infected has increased, particularly in the 20 to 30-year age group. Yesterday, there were 15.6% of cases between the ages of 20 and 30 years old, compared to 14.2% 4 weeks earlier. These young people are part of the community who are socially active, who continue to leave home on a regular basis, whether for work or for other reasons. And we may see more infections arising in this group as we lighten our SMM regimes in the community. Vaccinations help to reduce the overall rates of infection, and their relative young age and good health do provide some risk reduction for severe COVID-19 infection. But we must not be complacent and assume that all young people infected with COVID-19 will have good outcomes. We have seen some young people with severe infection and requiring ICU care. There are some who hold the view that because they are young or lack any other high-risk features, they are prepared then to take the chance of getting infected and hold out against vaccination. This is not a safe approach to take. I've experienced considerable pain and distress when going through our daily and weekly statistics for ICU cases and for deaths. There have been deaths among cases who are less than 60 years of age. And while many of them have concurrent medical conditions, I see some unvaccinated cases in our ICUs today who do not have a history of any other medical condition, and they remain critically ill. I'm not assured that they will invariably make a good recovery. The risk of death still exists for some of them. So don't play with your life and assume that getting infected is safe for you when you are not vaccinated. We continue to see a slow trend that's rising for children below 12 years of age in getting infected. They form about 11.2% of all infected cases yesterday, and this compares with 6.7% 4 weeks earlier. These children remain vulnerable because they are not yet eligible for vaccination to protect them from infection, and it's generally harder to get them to comply with disciplined mask wearing and safe separation measures. Many have mild infections, but we have seen a small number of children who required care in the pediatric ICU for either a more severe infection or for complications arising from their COVID-19 infection. And we talked about MISC in the last press conference. We continue to work with our expert committee on COVID-19 vaccines, or EC19V for short, on extending our national vaccination program to cover children between 5 and 12 years of age, so as to reduce their risk of getting infected and getting bad outcomes from their infection. And HSA will work with Pfizer on the regulatory approvals needed. We remain hopeful that we may be able to launch the expanded national vaccination program following these approvals for children less than 12 years of age, hopefully sometime in January 22 onwards. And in the meantime, the KK Hospital has started a study to determine how best to operationalize the processes for vaccinating these children, as well as to look at the safety and efficacy of the vaccine in the small cohort of children participating in the study. We continue to look at the experience of other countries similarly engaged in offering vaccination to children, so as to better understand the safety profile of the pediatric formulation, the vaccine itself. And in the US, we understand that for children less than 12 years of age, they have already vaccinated more than 2.6 million children with their first dose. So we will soon have robust, real-world data on the safety profile of the vaccine in children, which will provide us with greater confidence that the vaccines are safe for children less than 12 years of age in protecting them against COVID-19 infection. I should also share that the proportion of cases among those between 12 and 20 years of age has not changed in the same way, and it continues to hover between 4 and 5%. It's relatively stable. And in this school-going age group, the measures that have been taken in our schools to limit transmission in the school setting have so far proven effective in controlling spread. We saw 1,346 cases warded in our hospitals yesterday. These are more ill persons, either from their COVID-19 infection or because they have other concurrent medical conditions which require specialist care in our hospitals. Of the cases that remain in hospital, just over 200 cases required oxygen supplementation to support their breathing needs in the general wards. An additional 46 patients were unstable, needing closer monitoring in the ICU, and a further 64 cases were critically ill intubated, and put on a mechanical ventilator in the ICU. We therefore have 110 COVID-infected patients in our ICUs, all of whom require the care of dedicated ICU teams comprising doctors, nurses, and allied health professionals. Our healthcare workers also care for another 135 critically ill patients in the ICU with non-COVID related medical conditions. The overall bed utilization in our adult ICUs hovers between 57 and 59%, and this has steadily decreased over the past 2 weeks. Our overall isolation, general ward bed occupancy is just under 72%. And we continue to have adequate hospital bed capacity to accommodate the needs of our more seriously ill patients with both COVID-19 and non-COVID-19 related illnesses. Given the improving community situation, we will be resuming in-person visits to hospitals and residential care homes from the 22nd of November, provided the homes have enhanced vaccine-differentiated measures in place. And we are balancing the need to support the well-being of our patients and home residents to facilitate their receiving close family support that's conducive for their recovery, while at the same time continuing to protect vulnerable individuals in these hospitals and homes. The in-person visits will be allowed only when both the hospital patient or home resident and their visitors are fully vaccinated. And as a concession, we are allowing visits for medically ineligible patients, residents, and visitors. And if the patient or resident or their visitors are not fully vaccinated, in-person visits will only be allowed under exceptional circumstances on a case-by-case basis, as advised by the hospitals and the homes. And more details will be provided in our press statements following our press conference. As we progressively allow more community-based activities to resume, more interactions between people in both mask-on and mask settings will occur. And we expect the COVID-19 caseload to increase over time. We will monitor the bed utilization trends in our hospitals closely and take the appropriate steps to step up our COVID-19 dedicated resources if needed. And at this time, we will be making some minor adjustments to our bed capacity to ensure that we are able to keep our hospitals accessible to both COVID-19 and non-COVID infected patients with urgent needs. We have not as yet instructed our hospitals to resume all business as usual clinical services, given the possibility that there may be an upsurge in cases over the next 2 months as we adjust our community safe management posture. We have similarly adequate capacity to accommodate COVID-19 cases in our community treatment and isolation facilities. The CTF occupancy is about 33%, and it's well poised to accommodate any surge in community cases that may take place over the next few months. We have plans in place to expand our CTF capacity, and we can bring an additional more than 2,200 CTF beds into operation by the end of December if needed. I took a deeper look at the 64 COVID-19 patients that were intubated needing mechanical ventilation in the ICU. They range from 31 years to 83 years in age. Nearly 2/3 of them have not been fully vaccinated. In fact, more than half were unvaccinated. And unvaccinated people remain at the highest risk of getting COVID-19 infection. They continue to contribute to the greatest utilization of healthcare resources. In the last 2 weeks, 4.1% of unvaccinated local cases had severe conditions requiring care in our ICUs or had passed away from their infection. This compares with only 0.6% among the vaccinated local cases. In the last media conference, I was asked whether we had seen severe COVID-19 infections among those who received booster vaccinations. And I reviewed some of our data from the period between the 14th of September, when we first started offering booster vaccinations, until 18th of November, just a couple of days ago. And in this period, there were 26,013 COVID cases who had not been fully vaccinated, more than 14,000 local cases, I'll check that number, who had not been fully vaccinated, who had received booster vaccinations, and 4,755 fully vaccinated local cases who did receive booster shots. We haven't completed our data analysis, but there are some emerging data trends that I would like to update you. If I focus on seniors above the age of 60 years, 29.8% of those who had not been fully vaccinated had severe infection. And this compares to 4.1% of those who had been fully vaccinated and had not received their booster shots yet, versus 0.85% among those who had been fully vaccinated and had completed their booster vaccinations. In those less than 60 years of age, a similar pattern is emerging. There were 1.3% of those not fully vaccinated who had severe infection, compared to 0.18% among those who had been fully vaccinated and 0.09% in those who had been fully vaccinated and had received their booster shots. So being fully vaccinated protects you from getting a serious infection. And if you're eligible, getting your booster vaccination further increases that protection. So please, if you are eligible, don't delay and do get your booster vaccinations now. Thank you.
Good afternoon. I join my fellow MTF co-chairs in thanking everyone in Singapore for your cooperation throughout this stabilisation phase. Through our collective efforts, we are now able to exit the stabilisation phase and continue our transition to living with COVID-19. So the key move we are making today is to increase the group size for social gatherings from 2 persons to 5 persons. And that means that every household can receive up to 5 distinct visitors a day. It means that up to 5 vaccinated persons can dine together in F&B outlets from the 22nd of November or next Monday. The dining rules will apply a day later to hawker centres and coffee shops, to a selected group of hawker centres and coffee shops. And that's because we have explained the need to put in place the proper control systems in these settings. So the first batch of hawker centres and coffee shops will be able to do so from the 23rd of November onwards, and subsequently other hawker centres and coffee shops will join them through the next few weeks. So for hawker centres and coffee shops, they will be able to also have 5 persons dining, so long as the control systems are properly in place. With this move to exit the stabilisation phase, we will correspondingly taper down the support measures from the government at the same time. I know many are keen to go out and meet with their family and friends and dine together in a larger group. I just want to remind everyone to stay disciplined and to exercise caution and restraint. We know that with this easing, there will inevitably be more social interactions, and we are bound to see more infections. If we are careful and we continue to comply with all the prevailing safe management measures, we should be able to cope with the increase in infections. Conversely, if we seek to push the limits, let our guard down, we will spark a resurgence of cases which can very quickly overwhelm our hospital system yet again. We are trying very hard to avoid such a scenario, and that's why we are moving incrementally and easing in small steps. So we take one move, we did a week ago, we ease a little, we watch the situation, it's stable, and we make another move, which we will do from next Monday onwards, and then we continue to watch the situation to ensure it's stable before we make yet another move. Of course, as we move in this stepwise manner, we want to ensure that our hospital systems remain protected and not get overwhelmed. As a last resort, if this were to happen, we cannot rule out further tapping of the brakes. And you see this happening right now in some European countries which have gone back to partial lockdowns. We will try our very best to avoid having to throttle back any measures or to avoid reversal of our moves toward easing. But we need everyone's cooperation to ensure that we can continue to move forward in a steady manner. And you will notice that in this round, we have deliberately focused the easing measures on just one key parameter, which is to move from 2 persons to 5 persons. And we are doing this together with further tightening of our vaccination-differentiated safe management measures. There have been requests for other moves to ease in other areas. For example, to relax capacity limits for attractions, for malls, and to ease restrictions in workplaces. Whole range of other areas where we could also relax the measures further. But we've decided to hold all of these back. So just make one move next Monday, 2 to 5 persons. Everything else we are holding back for the time being. And again, this is part of our incremental approach. So we will monitor the situation over the next few weeks, and if the overall situation remains stable, our healthcare system remains stable, we can consider the next series of moves, say, around end of December. So I'd like to seek everyone's cooperation for this incremental, step-by-step approach in easing our measures and moving toward COVID resilience. It's not a big bang approach. This approach will require all of us to be patient, to be disciplined, and to exercise social responsibility. But we are confident that this approach in the longer term will yield better results, will minimize casualties, and will, importantly, allow us steady progress toward becoming a COVID-resilient nation. Thank you.
Thank you, Ministers and DMS. We will now begin the Q&A segment. Dear members of the media, please use the raise hand function on Zoom if you would like to ask a question. Gentle reminder to speak slowly and into your mic when asking your question and to keep to one question each. May we have the first question from Straits Times, Yan Liang.
Good afternoon, Ministers and DMS. This is Yan Liang from the Straits Times. There have been news reports out of Malaysia that the reopening of the JB Singapore land border will take place on November 29th, the same day as our VTL with Kuala Lumpur. My question is, can you confirm this date? And if not, what's being finalized? And when it starts, how does the government intend to manage this potentially large influx of travelers? Thank you.
Thank you. I've been asked this question several times, and let me explain that the Singapore and the Malaysian counterparts are working very closely together to work out the operational details to ensure that when we open up this VTL for land, it can be done so in a safe manner. And we have been working very thoroughly and with multiple agencies, and I'm optimistic that we will be able to open up to launch this VTL for land around about the end of this month, close to the launch of the VTL for air, and it is also possible that we may be able to do so on the same day. But I must qualify to say that the details are still being worked out, and we hope to be able to share the plans sometime next week, so that there's time for Singaporeans who want to make the travel to make the necessary arrangement. The details as to how Singaporeans can book the tickets and make the arrangement to travel will be explained later, probably next week. And we will start with a smaller number with a certain limit quota. We are not likely to go back to the pre-COVID-19 days where you have hundreds of thousands of people traveling both directions every day. We are likely to start with a smaller number. The priority is really to allow families who have been separated for a long time since the start of the COVID-19. Some are working here, wanting to go back to reunite with their family members. Some Singaporeans are working in Malaysia, want to come back to Singapore to be with their family members. So I think the first phase of the VTL for land is likely to focus on this group of people who have a need to meet up with their family to be reunited. And subsequently, we can think about expanding the scope to allow more people to travel. I think it is also important for us to ensure that we are able to do so in a safe way through tests and so on to make sure that this VTL land will continue to be able to allow citizens and PRs from both sides and residents from both sides to travel safely.
Can I just come in here for a while? Just one piece of statistic that you might want to just take into account. Currently, the Singapore 7-day moving average infection rate is slightly under 40 per 100,000 population. For Johor, 7-day moving average is about 13 to 14. Also, I want to just go back to something I said earlier. I said we are moving to 5-month interval between second dose and booster on the 29th of November. I made a mistake. It's 24th of November, not 29th. If you can just correct that. Thanks.
May we now have the next question from Zhao Bao's Ke Yang?
Good afternoon, ministers and DMS. Just now, Minister Ong mentioned that there's an emerging view that the COVID vaccine is more likely a 3-dose vaccine. So does that mean that eventually we will be looking at having 3 doses to be completed the vaccination, and will work from home still be a default from next Monday onwards? Thank you.
Short answer to the second question, work from home is still the default. As Minister Lawrence Wong mentioned, we're keeping the move simple, 2 to 5. With stronger VDS. That's essentially what we are doing from next week. As to whether 3 doses, I think in the you can see many top scientists, clinicians are all expressing that view, that with Alpha variant, 2 doses was probably the right design. With Delta variant, more and more scientists, clinicians are saying it ought to be 3 doses. So I think eventually we probably would like to have all our population, as many as possible, complete 3 doses. I don't know if DMS would like to add further to this view.
Thank you very much, Minister. The Expert Committee on COVID-19 vaccines has looked at this, and they're increasingly of the view that for the adult population, certainly those that are in their 50s and above, they strongly recommend going for that booster vaccination. If you were immunosuppressed, had a medical condition that led to you not being able to mount the adequate immune response from your original 2-dose vaccine regime, then the 3rd dose is in fact required for you. Otherwise, you would not be adequately protected from the first 2 doses. So this is very clear, particularly for our seniors, that they must do this. And as we go further down into the adult population, the working population, we recognize that these individuals also have risks of getting infected. We've seen that in the data that we have. And the recommendation also applies to them. And we have prioritized particularly those who are working in the essential services, who are at the front line and whose risk of getting infected, in fact, is higher than the average other people within the population itself. So very clear to us that they require to complete their primary vaccine regime, and if they are eligible, we strongly encourage them to go for the booster vaccinations. In fact, the bringing forward of the interval, the eligibility interval, is to allow for more to be able to benefit from the booster vaccinations when we recognize that the vaccine is waning around that period of time, if only to further protect them from Delta variant infections in the community. We continue to study what the benefit is for booster vaccinations in those below the age of 30, and we're looking very closely at further data coming out internationally for vaccinations occurring in this age group. So, for example, we know that in this group, booster vaccinations have benefit, that's clear, but we want to be assured that the safety profile for the booster vaccinations indeed still continues to demonstrate that it is beneficial overall for those below the age of 30 to receive booster vaccinations as well. This is the age group where there's a slightly increased risk in the primary regime for myocarditis to take place. In the emerging data coming out from the booster regimes, we have been pleased to see no such signal of an increased risk of myocarditis so far. And this is with the adjustments in the booster dose to provide a similar efficacy as the primary regime, but with we anticipate a slightly lower risk of side effects. And we hope that the data will continue to mature and to continue to affirm and confirm this a booster regime, a booster course in those less than 30 remains safe. And if our expert committee is able to sign off on this, then certainly the national vaccination program will extend then to all ages above the age of 18 for this particular purpose. As we've discussed earlier, we are looking at the national vaccination program extending to even younger age groups, but it's too early, too soon to tell whether those individuals in those age groups will require 3 doses as opposed to 2. And I think as the data further evolves, we will be able to make recommendations downstream concerning whether or not booster vaccinations are required for these younger ages.
Let me just add on to the comment on the work from home guidelines. I understand that many companies, many businesses are asking for more flexibility with regard to the work from home criteria. I should emphasize that the move that we are announcing today is a significant move, moving from 2 to 5 for social gathering and to allow 5-person dining in without being a household member is a major move from the perspective of public health. And it is important for us to try to hold the others where they are, monitor the situation, ensure that the infection continues to be under control. Then we will be in a better position to make subsequent moves in time to come. So we are very mindful of the need to allow workers to go back to work, for companies to continue to operate with a team approach. And many companies do want to have interaction, face-to-face discussions with their employees. We understand the need, but we need to do it in a very step-by-step cautious approach so that we can continue this journey of opening safely.
Thank you, Ministers and DMS. Next, can we have Geraldine from CNA?
Prime Ministers and DMS, I would like to ask about the vaccination regime so far. So I think recently it was revealed that under current regulations, the vaccination status of an individual is only valid for a year. So given this information now, is the government looking at a half-yearly or sort of yearly booster vaccines? And are there any plans to indicate if somebody has taken a booster shot in the Trace Together app?
There was a forum letter in the Straits Times that triggered this, and then MOH has issued a reply and a clarification. So the explanation has not really changed since we issued that clarification. From the legal drafter's point of view, they needed to specify a date in the regulations. And so they just used 365 days. Yeah, more for drafting than anything else when we consulted them. But it doesn't reflect public health policy. It was just the way the regulations was drafted. As to whether there will be an expiry date to 2 doses, vaccination status expiry date, whether there will be one, this is something the EC19V still have to consider, and they still need to look at international data as well as local data. So it's premature for us to specify any expiry date at this point. But what I mentioned earlier, and I think we ought to just register, is that increasingly we are hearing top clinician scientists in the world saying that with Delta variant, possibly, especially as DMS have mentioned, especially for the more vulnerable groups, it looks like it's a 3-dose regime, just like hepatitis B. And indeed, we are seeing many of our population, many individuals of our population taking up 3 doses. So I think this is just some initial signals that we are seeing. We know that this pandemic always evolve, and there are always new information, new developments. So we thought better highlight all these things that's happening around the world.
Thank you, Minister. May we now have polling from Channel 8 TV News.
Hi, Ministers and DMS, polling from Channel 8 News here. So now that we are opening up from 2 to 5 packs, regardless of households, especially for dining, why are we not considering 8 packs for those that are from the same household for dining? And also, could we have a Chinese soundbite for the 3 reasons that Minister Ong earlier mentioned on why we can further open up? at this moment? Thank you.
We emphasize throughout just now all the co-chairs have been talking about taking an incremental, step-by-step approach. So it is advisable we make one step first, watch how things, how the infection situation is like, what our hospital situation is like before we make the next step. And I think as one first step, which is already a very big step on Monday onwards, to move from 2 to 5 across the board for house visits, for F&B, without limiting to households, that's already a significant move. And it will result in more interactions. It will lead to more infections. There is no doubt. Again, we just want to call on people to exercise restraint. Don't push the limit. If our attitude is always keep pushing the limit, there is no doubt before too long you will see a resurgence of cases. Our hospitals will get overwhelmed again, and we will be back in this very difficult situation of deciding how to manage our healthcare system, as you see now in Europe. So let's take it one step at a time, and each time along the way, always remain controlled, remain disciplined, and cooperate fully with all the safe management measures. As they say, slow and steady, we will get there at the end of the day.
Maybe I just add to that. When we increase group sizes, it's very significant. Just to illustrate how significant it can be, you meet with another, let's say group size of 2, you meet with another friend, and each of you meet another friend earlier in the day. That means each person have a group of 2 meeting twice a day. And if you multiply 2 by 2, that's 4 contacts. That's 4 contacts. Once you increase to 5, you meet with a group of 4 other friends, 5 of you, and each of you meet another group of 5 people earlier in the day. Number of contacts is now 5 by 5, 25. From 4, you just jump to 25. Yeah, it's almost 6 times more interactions. Once you increase 2 to 5. You increase to 8, that's 8 times 8, 64. So it's actually an exponential increase in number of interactions. So I think it's actually a very significant move. And we have to all take a deep breath and really think very carefully, look at all the data very carefully before we decided it's time to make this move. As to why we take this move, let me try to explain now in Chinese. 这是我们现在在这个对抗疫情是一个转捩点，所以我们决定下个星期开始，聚集的人数从2位增加到5位，这是非常重要的一个决定。为什么又会做出这个决定呢？第一，我们的这个疫情的趋势的指标都有正面的发展。哪一些指标呢？病人量正在减少。10月份呢，病人量每天的病人量都超过2万，最高峰的时候是26386人，现在已经降低了，只是在15000人多一点点。第二就是疾病的传染度，传染度现在在徘徊在0.9到1.0之间，就是说每天的这个病人人数会慢慢的减少，而且很重要的就是现在的人流量在社区里面的人流量，其实比起我们预备期就是 preparatory phase 那时候的人流量只少了5%。这意思就是说，我们的人流量虽然增加的，但是病情没有提高，需要严重疾病的人没有提高，也意味着我们的社会的这个抵抗力，对这个病毒的抵抗力也增加了。还有一个指标就是病重者，病重者也逐渐的减少。10月底呢，大概有140名冠病病患者在加护病房，就是在 ICU， 现在人数减到大概110左右。更重要的就是病重率，就每1000个病患者当中有几个 会得到非常严重的疾病，需要进 ICU 甚至死亡，这个病率也是在减少。8月的时候，每1000的感染的人，12位进入 ICU 或者死亡。9月减到6人，10月减到5人。如果11月有数字的话，我相信会比5人还少。这都是我们努力做出来的，尤其是不断的为年长者进行接种疫苗。我们在2星期前呢，就是10月底，65000个年长者还没有接种疫苗，就是60岁以上的年长者还没有接种疫苗。现在已经减少到59000个了，大概5000到6000个年长者在过去的2个星期中已经完全接种了疫苗，这救了很多命，救了很多命。第二就是我们的疫苗差异安全措施也是正在展开。展开过后，许多还没有接种疫苗的人，他的这个行动就被约束了，尤其去一些人流多的地方，而且会把口罩拉下来谈话的地方，例如咖啡店、小贩中心，现在他们的行动也被约束了。约束了过后，就保护了他们，减低了他们遇到这个病毒的风险。也有很多年长者、很多人士还没有接种疫苗，因为希望恢复他们的一些活动，也前去接种疫苗。所以在指标上面，形势是比较可观，可以让我们比较开放。第二个大方面就是我们现在的这个脚车向斜坡再走下去，但是我们知道我们的刹车器是有效的。有什么刹车器呢？第一就是追加剂的计划，如火如荼的展开。接下去的1个半月，就是到年底之前，我们希望能够为多150万个国人，让他们接种追加剂。接种过后，自己的抗体就会提高，而且是新鲜的抗体。第二就是我们的这个 VDS 啊，就是疫苗差异安全措施，也会开始在小贩中心跟咖啡店开始实行，这是非常有效的。就像我刚才所说的，能够减低还没有接种疫苗的人，他们遇到这个冠状病毒的风险，大大的减低。此外，也会很多人在感染冠病后，接下去1个月半，他们会健康安全的康复，而且他们康复过后，会增加我们社会对病毒的抵抗力。所以这2个是重要的考量，趋势比较乐观。第二，我们的刹车器也是会很有效，所以就变成现在我们眼前有这个非常珍贵的良机，允许我们可以进一步的开放。这肯定会导致大家有更多的交际和接触，也会提高这个病毒的传播力。我们也许会看到更多的病例，但是对我们整个医疗体制的这个影响呢，我们希望我们也会用我刚刚提到的几件事来抵消，就是追加剂、安全康复，还有疫苗差异安全措施。但是如果我们错过以下的这个时机，延迟到明年才来开放，到时候追加剂带来的保护呢，可能已经逐渐削弱了。所以病例总数和整体的公共卫生局势呢，到时候可能这个影响会更加严重。所以与其未来，不如现在开始小心翼翼的逐渐开放。
Thank you, Minister. We will now take the last few questions. May we have Philip from Bloomberg? Thank you.
Hello. You mentioned Europe earlier. I know this was asked last week, but the numbers there have exponentially increased, and it looks like it's going to get a lot worse. At the same, Austria has a lockdown now, right? At the same time, the imported case numbers in Singapore remain amazingly low. I guess only 4 cases yesterday. If those cases remain where they are, I wonder if Singapore sees any need whatsoever to be sliding countries up and down the category list if the situation were to get worse over there. And finally, if that could, if Singapore is any closer to perhaps getting rid of any quarantines in dedicated facilities whatsoever, considering these low imported numbers. Thank you.
Thanks for the question. We indeed look at a broad range of indicators when we classify countries according to their risk status. So it's not just based on the infection situation in the country, but we also look at the infection rate based on their test that we do for these travelers when they arrive at Changi Airport. So as you have rightly said, the test results, our on-arrival test results, show quite low infection rates for many of these arrivals from different countries, and that's why we have not made sudden changes to our classification systems. But as we monitor infection in these countries, the incidence rates of the travelers when they come here, then we will continue to make these adjustments as and when they are necessary. We have a system in place where we look at the whole range of indicators. Every fortnight, we will put up periodic updates to our travel system. So we will continue with that approach in a very systematic manner. On whether or not there will be adjustments to border measures such that at some point in time we may even do further relaxation, that is a continuing process. Right? We have already moved away from having to stay in dedicated hotels to allowing the quarantine to be served at home. We have shortened the duration from 14 days to 10 days. So we will continue to this process of reviewing to see how these border measures can be fine-tuned, adjusted while keeping Singapore safe. Increasingly, given our situation, as you heard just now, our infection rate is in fact still relatively high compared to many other countries. Right? And increasingly, as we move towards a more endemic situation, as will other countries, our focus is not simply on infection rate alone, but really to watch against new variants, especially variants of concern that may be more resistant to the vaccines. So that increasingly will be the focus and the approach as we look at our border measures.
Thank you, Minister. Can we now have Han Kyong from Yahoo News?
Hi, good afternoon, ministers. It was announced on Monday that up to 3,000 foreign workers will be allowed to go out of their dorms each day. This represents just about 1% of the 300,000 workers in Singapore. So given that about 98% of them are already vaccinated and they have been living under restrictions for more than 19 months, how soon are we able to see a fuller freedom of movement for these foreign workers?
It's the same approach we take, incremental, watching each move. After one move, we monitor the situation, we monitor the effects, and then we make another move. We are very aware that our migrant workers need that time, need that space to go outside, and that's why besides allowing them to go out to the community, we also have eased up considerably their time in recreational centers. So we've just announced that move on Monday, which is an important move. We will monitor the effects of that over the next 1-2 weeks, and then we will, if the situation remains stable, we will continue with this incremental approach. So that applies, as I said, the whole basis of our measures, whether it is for migrant workers, whether it's for borders, whether it's for the community. It's on the basis of taking a stepwise approach, data and evidence driven, and making these continued but steady and progressive moves towards reopening fully.
Thank you, Minister. Can we now have the final question from Sharanya from Business Times, please?
Good afternoon, ministers and DMS. I would like to ask about the roadmap ahead for reopening. Would this still be in line with the 4-stage roadmap that was previously announced with the transition stage comprising 2 phases? Otherwise, what are the milestones ahead that we can expect?
Let me take this question and do a quick roundup. I think we are now exiting from the stabilization phase. Stabilization phase was not envisaged in the beginning as we work out our roadmap. And now we are going back to the transition phase towards COVID-19 resilience. But the fact that we took a detour through the stabilization phase also tells us that we have to be prepared to be nimble, to adjust our approach while monitoring the situation in the infection situation on the ground, so that we are able to adjust and adapt as we go along. And the announcements that we have made today is a significant step towards our endpoint of COVID-19 resilience. And as Minister Ong explained, that from 2 to 5, although arithmetically it's just a number from 2 to 5, but in fact from a public health point of view, it is a very significant opening, and it poses significant risk, and that is why we need to be very cautious, take a step-by-step approach. And as we monitor the situation, we may then be able to make further adjustments as we go along. And we have to remember that if you look back during the stabilization phase, whenever we have a wave of infection, it will take quite a long time, several weeks, and sometimes 2 months, up to 2 months, for us to be able to bring it under control again, so that we can return to the journey towards COVID resilience. So every time when we have an outbreak, when we have a major wave, it will take a long time for us to bring it under control. And sometimes more haste, less speed. If we try to open too quickly and you have a huge wave, it will set us back even more. So it is important for us to be prepared to make step-by-step approach. And also, we would urge Singaporeans to also work with us. We need your support to continue to remain vigilant. Even though we have opened up the dining in criteria, please don't rush to celebrate and have a gathering, multiple gatherings in the day, because it's, as Mr. Ong explained, it's a multiplying effect, and we will have a potential risk in the weeks to come, and that will set us back again. If you are able to exercise social responsibility, and if you need to go to big gatherings or big events, do take a test to make sure that you are not the one that is imposing a risk on other people. And this way, we can then continue on our journey, stay on course as we transition to a COVID-19 resilient society. So thank you very much.